Hi guys, so in this video we are going to talk about diabetes mellitus, team know your sugar as it does not always give you sweetness in life. So what is diabetes mellitus? According to the World Health Organization, diabetes mellitus is a chronic metabolic disease characterized by high blood glucose levels which may lead to serious damage to the heart, blood vessels, eyes, kidneys, and nerves over time. According to the National Health and Morbidity Survey 2019, approximately 3.9 million of Malaysians are living with diabetes. The prevalence rate has increased from 13.4% in year 2015 to 18.3% in year 2019, which is equivalent to 1 in 5 adults. This gives Malaysia the title Sweetest Nation in Asia. Before knowing how diabetes mellitus is developed, let's know more about the normal physiology of glucose uptake in the body. In the digestive tract, the foods consumed will be broken down into glucose and released into the bloodstream. High blood glucose levels signal the pancreas to release insulin, and the insulin will stimulate the body cells to take up glucose from the bloodstream to be used as energy. There are two main types of diabetes mellitus. The first type is type 1 diabetes mellitus, which is also known as insulin-dependent or juvenile diabetes, and the second type is type 2 diabetes mellitus. In type 1 diabetes mellitus, the pancreas does not make insulin or make very little insulin. The glucose cannot get into the cells, hence leading to high blood glucose levels. In type 2 diabetes mellitus, the cells do not respond normally to insulin. This condition is known as insulin resistance, whereby the glucose is built up in the bloodstream as well.
Next, I'll briefly describe anti-diabetes risk factors. The risk factor for type 1 diabetes includes family history and can develop at any age, though it often appears during childhood or adolescence. The risk factor for type 2 diabetes includes genes and lifestyle factors. The non-modifiable risk factors are family history, race or ethnic background, age after 40 years old, and gestational diabetes. Meanwhile, modifiable risk factor includes a sedentary lifestyle, which is physically active less than 3 times a week. Weight also contributes as a main factor of diabetes. Insulin resistance is often associated with metabolic unhealthy obesity individual. Next, individuals with unhealthy lifestyles such as smoking and heavy alcohol consumption can affect the production of insulin due to liver damage. Adding on, a diet high in fat, calories, cholesterol, sugar, and salt contribute to the prognosis of diabetes.
So, how do foods affect blood sugar? The sugar in blood comes from certain food called carbohydrates or carbs. The more carbs you eat, the higher your blood glucose will be. Here are some tips to prevent diabetes mellitus. First, lose weight and keep it off. You may be able to prevent or delay diabetes by losing 5 to 7% of your starting weight. Second, move more. Get at least 30 minutes of physical activity 5 days a week. Next, eating healthy foods most of the time and drink water instead of sweetened beverage. Moving on, let's see what food you can eat if you have diabetes. Eating the right foods for diabetes means eating a variety of healthy foods from all food groups, including fruits and vegetables, whole grains such as whole wheat, brown rice, barley, proteins such as lean meats, chicken, turkey, fish, eggs, and non-fat or low-fat dairies such as milk, yogurt, and cheese. On the other hand, the high-carb foods and drinks should be limited include sugary foods, drinks with added sugar, white rice, tortillas and pasta, and starchy vegetables such as white potatoes.
So, eating well is the key to managing blood sugar. But how should you assemble your plate? Diabetes plate model is a simple guide for you to plan your meal without counting or measuring. First, fill half of your plate with non-starchy vegetable, 1/4 of the plate of protein foods, and the last quarter with carbohydrate foods. Now, let us see why you need non-starchy vegetable. First, it contains a negligible amount of starch with a low glycemic index. This means that they do not spike your blood sugar like starchy vegetable. Besides, it is also high in fiber, which can provide feeling of fullness. The example of non-starchy vegetable include asparagus, broccoli, and cabbage. Next, by using the plate model as your guide, the protein can help to strengthen the immune system. It also provides good satiety and therefore can have a beneficial effect on weight management. There are many sources of dietary protein, including fish, poultry, and plant-based proteins such as beans and lentils. However, it is important to limit your intake of red meat, which is often higher in saturated fat, as it is associated with the risk of diabetic complications such as cardiovascular disease. The final portion is filled with half-quarter of carbohydrates. It is important to have sufficient carbohydrates in the daily diet to avoid hypoglycemia. Next, limit carbohydrate intake from sugar-sweetened drinks can reduce the risk of weight gain. So the choice of carbohydrates include whole grains such as brown rice and oatmeal.
If you're a diabetic patient, you may ask what's going to be in my schedule. Your schedule should include checking your blood sugar levels as recommended by your physician on a daily basis. Self-monitoring is beneficial as it allows direct evaluation of the impact of everyday activities, food intake, and medication on your blood glucose level. It can be done every morning, also known as fasting or pre-prandial measurements. Your target range is 4.4 to 7 millivolts per liter. Any higher or lower signals danger. Measuring can also be done 2 hours after your meals, also known as the post-prandial measurement. Your target range is 4.4 to 8.5 millimoles per liter. If you experience tremors, broken into cold sweat, or suffer from dizziness, you're probably having symptoms of hypoglycemia where your blood sugar drops below the recommended range. If these events happen as often as twice a week, go visit your doctor. Subsequently, every 3 months, it is important to visit your doctor to have your HbA1c levels taken, which should be less than 7%. The HbA1c test measures your average blood glucose control for the past 2 to 3 months, which tells you whether your medicines are working or not. Thank you for listening. That is all from Group